Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Hello and welcome. I'm Leanna McGuire, your host for this informative podcast on managing foodborne illness, brought to you by Elite Learning by Colibri Healthcare. Our subject matter expert today is Kirk Ornstein. He's RN, MSN, and clinical nurse leader, and a guy who's obviously really good at research. Welcome, Kirk. How are you?
Thank you. Good. It's good to be here.
Now, we're going to move on now to Campylobacteriosis. I did not slaughter that, did I? I thought I was going to.
No, that was good.
Not bad. Okay.
That was good.
All right. Talk to us about that one. Foodborne illness.
So it's there are 845,000 cases a year. So it's very prevalent. It's out there. 8,400 hospitalizations, 76 deaths. It has this unique feature that it only requires a small number of organisms to get you sick. So they say 500 organisms can make you sick. So basically, a single drop of fluid containing it, juice from a chicken, can make you sick. But the other side is that you don't get very sick. The symptoms are much more mild than some of the other things we've talked about. That's why you see that the 845,000 cases, but only 76 deaths. So although it's very prevalent, symptoms are much more mild, and that leads to obviously a lot of underreporting.
Okay, sure. Yeah, that would make sense. And where is this organism found primarily?
We're still talking about birds, so fowl, chicken, things like that. It's going to be there.
Okay,
and that's where you'll find it.
Okay. Cooking, does it apply in this case?
Right. Cooking, there's only a couple where you're looking at sort of extreme temperature issues with some of these pathogens. But again, like if you're cooking the food, this is going to take care of this pathogen as well.
Okay. And is it primarily ingested? Is that how you get this, or?
Right. It's the fecal oral route. And so for the most part, you're eating it. That's been contaminated from, whether it's the juice from the chicken or the feces from a bird. It gets in the system. It's going to make you sick. That's generally how you're getting it. Potentially, you could communicate to someone else through sort of oral fecal transmission. But again, because the symptoms are mild, that's not as likely as, say, norovirus, where the symptoms are much more violent, where you're throwing up and projecting these the pathogens into the air. That's not the case with this. You don't really see that.
And our consistent vulnerable population of pregnant, young, elderly, or immunosuppressed obviously are affected. I shouldn't say obviously, but we've already talked how that's consistent across. But how would their symptoms be different, or would they?
Well, for the immunocompromised, there's a little bit of an issue here that it can allow the pathogen to enter the bloodstream.
Okay.
So that doesn't have the same protection, and this can lead to septicemia.
Oh dear. Yeah.
So with this one, although again we're talking about a mild pathogen, we get these special populations, and you can get very unique symptom development. And septicemia, as we know, that goes south very quickly.
Mm-hmm. It sure does. And is it more common in one sex than the other? It seems to me I remember hearing that one is more vulnerable.
Yeah, it's interesting. It's more likely to occur in males and females, but the reasoning is is unknown. There's
Okay.
there's some ideas about it, but again, you see these differences in men and women, and a lot of times they don't know why.
Right.
If you remove things like pregnancy and things like that, if it's just if everyone is equal, if you've matched them all and everything, then it becomes why, and they don't really know a lot of that.
Okay.
Yeah.
And those signs and symptoms you've already talked about, mostly diarrhea. Would you say is that the primary with this one, or can you go into a little bit more about that?
What watery diarrhea is like everyone
Okay.
else, common, but you can see bloody diarrhea with this, and that's partly the reason why it can get into the bloodstream for the immunocompromised. Um, but unlike some situations where you see bloody diarrhea as an emergency with this particular pathogen, that occurs, but it doesn't mean that you're dealing with a severe situation that needs medical attention. But at the same time, um, when you're at home and you're having all this diarrhea and all of a sudden it turns bloody, you have to think that it's more significant because you can't do the diagnosis at home, and that is one of those flags to seek additional medical attention. Um, and so you come back, you're like, oh, you're fine. It's this pathogen, not that one. But it does have this characteristic of bloody diarrhea that isn't the emergency situation that it might suggest.
Okay. And can you get a fever with this?
Um, yes.
Okay.
You can get a fever with it. Again, it leads. It's similar to the bloody diarrhea. When we see a fever, we get concerned, and in this case, you can get a fever anywhere from 100. They say 100.4, but what that really 100.4 to 104. And so anything above 102, you're looking at a real problem.
Okay.
So that's the point at which you're seeking medical attention. Um, and so again, if someone had temperature of 104, I would tell them right away, you need to see somebody. You need to get medical attention. It comes back, oh, it's fine. This is just part of the natural symptomology of this pathogen, but you wouldn't know. You have to go
Sure.
check it out.
Yeah.
And just a point to make,
go ahead.
when they say 100.4, that's your medical definition of a fever. Anything less than that is not considered a fever. And so that's how they came up with that number, 100.4.
Got it.
It's that definition of a fever.
Okay. Perfect. Thank you. And is this another one where we're maybe more susceptible in a more developed country than those who have been exposed to it more often? Would it be similar?
Right. This is one that's come out of the epidemiological research that indicated other countries have more exposure to it, and so their symptoms are not severe as, say, what we see here.
Okay. And are there any other maybe severe symptoms that may occur in less frequency or low frequency?
It's right. It's a lot less, but you can see bacterial endocarditis, reactive arthritis, meningitis. So a number of things can occur. Clearly, those conditions warrant medical attention, but it's not a common occurrence, but it can occur.
Okay. And stool samples is most often the way they diagnose. Is that correct?
Right. They're always, it's pretty much one of the first steps when you're trying to identify foodborne illness. You're taking stool samples. This is one of those cases where antibiotics can be used for a case that doesn't resolve on its own.
Okay. Okay. But in most cases, it does resolve on its own.
Right.
Okay. And do you have a real life example of this one?
There are two interesting ones. So there's a place called Kennedy Creek outbreak. So this is in Montana. It's a campground, and people were drinking from a stream. It wasn't a spring, just a regular stream. I can't imagine why they were drinking from a stream, but they were. And yeah, you got a number of people got sick from that. There was recently in New York City an outbreak in Brooklyn. Um, and they believe it was related to exposure um, to raw chicken. And
Oh.
so 50 people got sick there. But that was this year.
Since it resolves so quickly, I wouldn't imagine that all cases get reported either.
No, exactly. You see this with all of these conditions when they have a short duration, they're not going to get reported.
Got it.
Either, and it's kind of interesting to think like you could have these very severe symptoms. You would think, oh, you got to go get checked out. But the reality is you're so sick, you're not going anywhere.
Right.
And
That's
so,
right.
so you've got this sort of thing where, it could be severe and you're not going to go because you're too sick, or it's so short, you're not going to go because it's so short.
Right.
And so these become some of those barriers to getting medical care that it goes by so quick, you can't get there, or, you're too sick or it's too short, that it all ends up underreporting. There's not a single thing that we talk about that isn't underreported, except for maybe botulism.
Got it.
Because you're not going to have mild symptoms.
Right. Exactly.
It's the only one that's consistently severe.
Okay. The next one on my list that I wanted to discuss was Listeria.
Yes.
Serious,
yes,
not serious?
That's a serious one. That is third leading cause of death.
Wow.
Yeah, it has this.
From food poisoning?
Well, it's from food poisoning, but the issue really is that it can thrive at 32 degrees. It can survive as low as 0, so Fahrenheit. So it has the capacity to live inside of a refrigerator and multiply inside of a refrigerator. So this is one of those ones where when you're talking about temperature, below 40 degrees, it's not going to matter. And it can also survive for years. There was a report that said that they found this organism 11 years later in a food processing plant.
Goodness.
Right. Because it can live in these environments or these temperatures that you normally think this is fine. We don't have to worry about pathogens. It's freezing temperature. So why would there be an issue here?
Yeah.
But it's so it's a problem. And again, this is one of the ones very specific to vulnerable populations. You see it in a lot of times in deli meats, because it can live at these temperatures. It ends up in these meats, and the meats end up being obviously sold to individuals, and they get it for that. But it can be deadly to pregnant women and their babies, their fetuses.
Wow.
Absolutely, their estimates of for pregnant women risk of death 10 to 20 times higher than for other people.
Wow.
Yeah, it's deadly. What was it? Trying to remember how many cases. I think there's only like 1,600 cases a year, but it's one of the leading causes of death.
Wow.
So yeah, it's a problem.
Do we know why pregnant women are more susceptible than even the others?
No, they look at it as just, and this is epidemiological research or data, that the changes in their immune system allow the pathogen to travel through the placenta into, obviously, the baby. Now, as far as what exactly is going on there, they're not so sure about that. But they end up with something that's called invasive listeriosis, which is different than your regular sort of food poisoning. So where listeria, its symptoms are going to arise pretty quickly within a couple of days. Invasive listeriosis can take weeks to months to show symptoms.
Yowza.
And so for pregnant women, there's that issue that they could be incubating this pathogen during long stretches of their pregnancy.
Right.
They're most vulnerable in the third trimester. And so if someone starts to show symptoms, they will be tested and treated for it. And in this case, you're getting treated with intravenous antibiotics. But it is can be devastating for pregnant women.
Right. So vulnerable. The pregnancy itself, they could they lose the baby and
Absolutely.
survive themselves? Oh wow, that's devastating. All right. Wow, that's crazy. So symptoms related to this. You talked about initial symptoms and then potential symptoms later. So what would we watch for?
Well, in the non-invasive form, you're looking at the same sort of GI issues that you see before.
Okay.
So you're looking at the same symptoms. You're dealing with the same way. Not much changes. But with the invasive, you're looking at different things. You're looking at fevers. For the invasive, you're really looking at a fever on top of the GI. But the GI symptoms in the invasive cases aren't really the issue because there's that incubation period of weeks to months. And so it's hard to distinguish between if a pregnant woman gets a fever, what does that mean?
Right.
How do you link it back to eating deli meats?
Sure.
And so that adds to the issue of inability to treat.
Right.
Because you can't make that connection. And then as this progresses, obviously the danger to the mother and the fetus just becomes exponential.
Right.
And yeah, it can be a real difficult situation.
Possibility of septicemia at that point?
Yeah, well, that's the whole thing. Once it's inside, so it's invasive. Again, it goes back to the idea of once it gets out of the GI tract, you got septicemia. You could have all these other sort of deadly conditions that just you're just going to die from.
Right.
I mean, it's that was one of the bad ones.
So is this one related to chicken again? Is that our main concern, or?
No, not so much chicken. It becomes, like I said, that like deli meats.
Oh, right. Deli meats.
It becomes these processed foods that are refrigerated, but because of the nature of its ability to withstand cold temperatures, it just stays there. One of the problems with this is the issue of cross-contamination. Because it can survive for such long periods of time, it can contaminate everything in the environment or the surrounding environment. So when you're talking about a deli meat, anything in that sort of refrigerator can become contaminated because there's nothing there to kill it. It's sitting there for days, weeks, months, years. And so that's the big issue with that. And it's interesting that it's deli meats because it's not something you really think about. But the reality is that it's one of the main sources. And so one of the interesting things about this is that one of the protective measures is to heat any food you get from a deli to 165 degrees. Right?
Wow.
Especially for immunocompromised, vulnerable groups. But that also includes like cheeses.
Oh,
so I'm wondering myself, what does cheese look like when you heat it to 165 degrees? So
yeah.
So this is one of the things where I'm thinking like, well, you got to take all these precautions, but then some of them just become like a little weird. I mean, yeah, you got to do it, but then what are you doing? So that's when you're like, just don't eat it. Just don't eat. Don't go to the deli. Don't eat deli meat.
Yeah.
So, but right. So it's a tough situation. But and there are outbreaks all the time. There's actually one going on right now
Really?
Yeah, it's actually ongoing right now. 6 states, 16 people, 13 hospitalized, and one death. And the one death was a pregnant woman.
Oh, oh, that's so
So,
heartbreaking.
yeah, so that was an outbreak that occurred from, I guess, April of 2021 to September 2022.
Wow.
Um, and they still can't identify the source because of this issue of cross contamination. So many things get contaminated by this that the source itself gets lost. Um,
Oh, wow. That's devastating. Um, and treatment and prevention, just quickly. Obviously, well, you're saying don't go to the deli. That applies, obviously, or maybe it's not so obvious to those who are more vulnerable.
right. Well, this one is very particular as far as its um, the vulnerable population and the virulence is really specific to those populations. But at the same time, people can still get sick from it, and so I often look at the deli and think, well, should I really get something here? But you have the thing with not a lot of people get it, even though it's um, can be deadly. So you're kind of taking these chances, but it's sort of the case with all this stuff. You're sort of balancing that risk reward kind of thing. But that is one that the CDC, local health departments are always on a lookout for because it's so deadly.
And the meat that you ask them to slice at the deli, and then there's the packaged deli meat that comes, from whomever that's in a freezer or in a cold area. Same issue.
Yeah, same issue, slightly different. So, in the sort of packaged meats that you get that are already prepackaged, came right from the processing. So they're not real. They're not going to. There's not the issue of cross contamination.
Okay,
So it's inside the package. Once it's open, you can have that cross contamination.
got it.
Whereas the meats in a deli that they're slicing, that environment itself is contaminated. And
Okay,
so even if that meat initially comes in as free of any sort of pathogen, put it inside that deli refrigerator, and all of a sudden it can be contaminated.
okay, got it, got it. Wow, that's interesting stuff. So another one that I'll probably not say this correctly, Clostridium
Mm-hmm.
perfringens. Is that right?
Perfungin. Perfungin.
Okay. Between the two of us, we've got it.
Yeah.
Another bacteria. So there's foodborne illness related with this too.
Yep. So, all right. So this is one of the leading causes of gastroenteritis. Little less than 1 million cases a year. You got more than 400 hospitalizations,
Wow.
more than 70 deaths. And so
Goodness.
this one is a rapid onset, short duration type of pathogen. Watery diarrhea, rarely is hospitalization needed. Again, we're looking at dehydration as your main concern. It is also one of these that has high temperature range tolerance, and
Okay.
so it is very comfortable in that 40 to 140 degree range. Um,
Hmm.
so it can withstand these temperatures. Now, one of the things that is unique about this is that it replicates very quickly.
Okay.
One of the implications of that is that you will see it in large gatherings. So this is the one when everyone goes to the community cookout and they all get sick. This is the one.
Okay.
Um, so so for this, it's very much about maintaining proper temperatures for foods that you're serving. Um, but it is the one that will be the community gathering where everyone's getting sick from it, because it does replicate so quickly that even though you think the food has been cooled or hasn't been out that long, it doesn't take that much time because it does replicate so quick.
Okay. So the guy who orders his steak rare at the cookout, is that more vulnerable then?
Well, that's interesting. The steak's different. So when you're talking about a steak, you can actually cook it at a much lower temperature.
Okay.
It was 145. What this is that it's when foods are mixed together. So it's going to be in salads. It's going to be in those type of foods. A steak itself is often, meat's often associated with a E. coli, right? And so that's in the gut. When you have ground beef, we're a little off topic right now, but when you have ground beef, that's getting ground up with all the other sort of material, and that sort of material inside the GI tract will get into this meat and contaminate it.
Got it.
Whereas a steak, you can get that sort of pathogen on the steak, but it's not in the steak.
Okay.
And so basically you can cook the surface of it, which will kill off any of those pathogens, but generally there's not something in the steak. So steaks can be generally cooked at a lower temperature. So that I don't know if super rare is going to do it.
Okay.
But having a medium rare steak isn't the problem that say a medium rare hamburger has.
Okay, I got it. Perfect. That explains it really well. Thank you for that. Treatment and prevention.
Yeah, as the other ones, this is just like supportive care. So it's fluid loss. And again, this is one of those ones where antibiotics shouldn't be given because it can create environments that allow further growth.
Okay.
So, but it continues to be that same process. It's also because of the way it is. It's highly underreported. So the true extent of the number of people who get sick could be much higher.
Right.
But again, there's no way to really know.
So you mentioned E. coli. How about we go there next?
Oh, there we are.
And we all have this, right? This is another thing that we
right. So this is one of very common part of our natural flora inside our system, inside our body. Generally, never really causes a problem, but but certain strains, because there are numerous strains of E. coli, certain strains can cause illnesses. Generally, this is when we think about traveling. This is the one they think of, traveler's diarrhea.
Okay.
This is the one you're going to get when you're traveling, or when people get sick from traveling. It's usually this is the source.
Okay.
But again, these are situations where you're really dealing with best supportive care, hydration, and it passes. There is a particular strain of E. coli, 0157, which can be very, very damaging to the body. Basically, this one can cause hemolytic uremic syndrome. So basically, it causes inflammation damage to the blood vessels to the kidney. So you can end up with kidney damage. You can end up with kidney failure because of the damage to the blood vessels. You can end up with clots, throwing clots, and all the issues related to clots and heart conditions, strokes, things like that. And so that particular strain can be extremely deadly for anyone who comes in contact with it. This is another one of those that states and the CDC are always looking out for, because it can be so damaging.
And what is the source of E. coli? And would it be different for the 0157 than it would be for just regular E. coli?
Now, the sources are the same. It's really that there are a number of strains that just naturally occur in our gut, in animal guts, and so it's a little bit of luck of the draw what you're going to get. In this case, what you see with the 0157 is heavy diarrhea for the first day, and then it turns into bloody diarrhea.
Okay.
And so this is the case where you see bloody diarrhea, you got something more than just your basic E. coli infection.
Sure.
And that's when you're starting to see this problem where the bacteria is now getting outside the gut and it's infecting other parts. In this case, the kidneys.
Okay. And is the onset, is it a slow onset or does it happen pretty quickly with E.
Now, this
coli?
is one that happens quick. This is a couple
Okay.
hours, and you're starting to have severe diarrhea.
Okay.
There's no mistaking being sick. It comes quick.
Okay. Got it. Boy, that is interesting. So real life scenario, do you have a real life scenario for E. coli?
Yeah, so this is one of the ones where it's actually salad. So there's the Power Greens packaged salads outbreak. So it was 10 cases, 4 hospitalizations, 1 death.
Goodness.
The interesting thing about this, and it sort of illustrates a fundamental problem with foodborne illnesses in general, is that this is prepackaged food, so it has multiple ingredients coming from multiple sources.
Right.
And so the ability to actually figure out which part of that salad was the cause
Oh,
becomes
yeah.
very, very difficult. And so, tracking back this where the infection started is a slow process. And in this case, by the time they figured it out, the outbreak was already over.
Wow.
All the product was sold. There was nothing left. And so, again, it's one of these situations where they figured out what it was, but it didn't matter anymore.
Yeah.
Yeah.
And I know with some of these, as we've gone through them, antibiotics are helpful for some and not for others. What about this one?
So, 2 things about this. One, you want to know about taking antidiarrheals. So, in this
Mm,
case, you don't want to do that because it basically stops your body from eliminating the pathogen. And so, you don't want to have the antidiarrhea. Um, and and antibiotics again are not beneficial.
okay.
Um, you know, because they can have a negative effect upon uh, the hemolytic uremic syndrome. It can make it worse.
Okay.
Um, so again, most of these times they're going to let your body work it out on its own, and generally in the most severe cases will they actually use them, and that is not universal because we've seen there are a number of different pathogens where antibiotics can make things worse, whether it's causing the toxin or the bacteria to break open, spilling out more toxins, or eliminating natural flora so that that particular organism doesn't have anything to compete with, and so it can really just flourish. So generally, antibiotics are really not used.
Wow. Okay. Got it. And it's exciting to continue this conversation. Learned so much so far. Let's move on now and we'll talk about vibriosis. Am I saying that right?
Perfect.
Good.
Perfect.
All right.
So vibriosis, it's in uncooked shellfish, and
Oh,
especially oysters. So this likes to grow in brackish water. It's water that's um, seawater and fresh water mixed together. That's the environment that it grows in. Um, and CDC estimates about 80,000 cases a year, 500 hospitalizations, 100 deaths. Um,
goodness.
so, so it shows up. Obviously, it's the same when we eat raw shellfish. That's what we're always thinking. There are a couple different strains of vibriosis. The one that we talk about the most, or the one that's the most vulnerable, is the Vibriosis vulnificus. Um, so this one isn't very common, but it is deadly.
Oh,
Um, Yeah, it doesn't, like I said, not a lot of cases, but the fatality rate is 35%. Um,
Goodness,
right. So normally,
significant.
yeah, normally when you get Vibriosis, we're dealing with a mild strain. Um, this is going to be just like a lot of other things. You're going to have your diarrhea, stomach pains, cramping, and generally it resolves on its own. Um, but like I said, there is the other most Vibriosis volnificus, 35% fatality, and then there's also Vibrio cholerae, which is cholera. Now, that one's really interesting in that uh, it causes you to lose huge amounts of fluid. You can lose up to, in this case, a liter of fluid an hour.
Whew.
Um, right. So that when we hear about cholera, it's generally in, we don't have it here. It's not really an issue here. It's developing countries, but it can be deadly because of the fluid loss. Um, and obviously, all things associated with that, whether it's cardiac conditions or, um, you know, mental mental disturbances.
Sure. This deadliest one, are they all from raw oysters or?
They are all existing in that environment, that shellfish, oysters environment, and so you can come in contact with that obviously by eating those type of foods, but they're living side by side as far as they're concerned. Um,
Wow.
so you can eat it. You can also get it through wounds. So if you're in the water and you have a cut in your leg, you can get it that way as well. Um, and with the Vibriosis volnificus, um, often that results in amputation because it
Goodness.
is so aggressive that it will cause sepsis, severe damage very quickly. So that is obviously one that you should avoid at all cost. It's also sometimes referred to as a flesh-eating disease or flesh-eating
Okay.
bacteria. So when you hear that, there are a number of ones, but it can be this one as well.
Goodness. Okay. So the oysters get infected from the water, and then we ingest the oysters, or we're in the water and the wound. We get it in through the wound.
Right.
So salt water only, obviously, is my assumption because it's just the oysters or anything else from seawater that we can get sick from, or it's just primarily those
Well,
oysters.
that's the yeah. It's those shellfish, but to your
Shell.
point, it doesn't actually survive in fresh water, which actually has certain things or conditions that are helpful to us. So it doesn't end up with this oral fecal route because we don't have salt water in our body. I mean, there's some salt in it, but it's not really going to survive in that environment. Um, it's not nearly as hardy as some of the others. So
Hmm.
it's susceptible to acidity and freezing and cooking, and a lot of general cleaning products, disinfectants, bleach, alcohol.
Hmm.
So it can be managed as long as you're not eating raw shellfish. And I know I've had oysters, raw oysters, and I've never had a problem with it. But the reality is, you never know what you're getting. And
Right.
so anything raw is problematic.
Boy, so it's interesting that we have the knowledge, but we still continue to have places that serve things like roy oysters. That's yeah. Okay. Well, that is interesting. Uh, kind of take your chances. So
Hmm.
you have the onset of the diarrhea, vomiting, all of that same stuff, and the treatment then would be the same
Yeah.
fluids.
Yep. You're dealing with best supportive care, and sort of managing it that way, um, just like many of the other pathogens that we've been talking about.
And the symptoms, do they show up pretty quickly for this one?
With they show up. Yeah, they show up within a couple hours. Um, so the vulnificus takes a little longer, but that could be a day, two. But but they show up not as quick as say some of the others we talked about, where it's like a couple hours. But
Sure.
Yeah.
Wow, that is really interesting. Do you have a real life scenario for this one?
Yeah, actually, yes. So this is kind of sad. So Hurricane Ian,
Uh-huh.
um, it it brings in obviously all this salt water
Uh-huh.
into the land, and with it bring all these pathogens. And so in this particular case, Vibrio vulnificus, they were calling it a flesh-eating disease. They didn't really name it as what it is, but 65 cases, 11 deaths, all through open wounds.
Wow. So is this just living in seawater all the time, and it just
Yeah,
depends on? Okay, interesting.
yeah. Well,
Dead. Go ahead.
it's sort of collecting within these shellfish, but that's sort of the situation with all of these. That these are, other than some of the ones we talk about living our skin, they're endemic in the world. They're living in the soil. They're living in things. It is just around. It's
Right.
you
Right.
know the hosts are varied and numerous, and you try to avoid them the best you can.
Wow. Okay. And so prevention. Well, I was just going to say don't eat raw oysters, but you're always taking a risk swimming anytime with an open wound, right? I mean,
Yeah,
that's pretty
that,
much, yeah, regardless.
absolutely. People don't really think about that much because, like, oh, it's salt water and salt's supposed to be good for the wounds and things like that. But and it's what I used to think. I'm like, oh, it'll clean out, it'll be good. But the
Yeah.
reality is it's just another access point for pathogens to get in.
And it doesn't have to be a big wound. Like we're not talking, a recent incision or something. It could be
No, just
anything.
yeah, just a
Paper
cut.
cut or just a
Yeah,
cut. Just a cut.
yeah.
Okay. All right. Wow, that's interesting. So let's, for example, let's talk about the bacteria, the typical start of symptoms with bacteria with some of these that we've discussed so far.
Well, we just talked about the Vibrio, and I want to just look at that one a little bit. So
Sure.
the Vibrio that is not as virulent, you'll see symptoms within a couple hours, 96 hours. You'll see watery diarrhea, cramping, vomiting like you normally would, and sometimes fever, and it resolves 2 to 5 days. But the Vibrio vulnificus, that's a longer duration onset. So that's not going to come on for 1 day to 7 days. And that's partly the problem with how virulent it is. So it's not showing up till much later, but when it does show up, the infection is much more advanced. And so you sort of see that severity related to that incubation period, where the more general benign Vibrios is rapid sort of onset, and then um, you know 2 to 5 days later you're done with it. But again, both of those problems, like both of those are best supportive care kind of thing. You're managing symptoms, um, and with vulnificus, it becomes a real problem where death and amputation and things like that are occurring.
Right. Wow. So just to kind of summarize on some of these, so the Campylobacter is for start of symptoms is 2 to 5 days. Just to kind of do a recap, real quick
Yep.
recap. E. coli is 3 to 4 days, correct?
Yeah.
List
It's
more or
well, E.
less.
coli is really it's 1 to 3, but again, there's ranges to this. If you actually look at the literature, you will see lots of different numbers, um, because they can vary. It can vary based on the amount of organism that you are infected with, um, but you're really looking at like which ones are the rapid onset ones, which ones are more delayed. So that's sort of how better way to think about it.
Yeah.
Um,
Okay. I like that better. So the ones that take longer would be, just so we have them in our head. Most of them come on within, the first few days, but there are some that take longer, correct? Like
right.
salmonella can be later. Yeah.
Yeah, and so and things like um, the perfringens is going to be 8 hours, 16 hours kind of thing. Botulism is a rapid onset.
Sure.
E. coli slower. Listeria can be a rapid onset, 9 hours, 48 hours. But again, that one also has the invasive form, which isn't going to show up for 2 weeks to 6 weeks. Norovirus, rapid onset,
Right.
anywhere from 12 hours. Salmonella, rapid onset. So all of these, and again, they tend to have shorter duration as well.
Got it.
So for the most part, they're coming, they're going to be brutal, and then they're going to pass. And that's sort of the case. Sort of the rapid onset equates with the severity of the initial symptoms. So when they're coming on quick, they're coming on like gangbusters, and then they're going away.
Got it. Okay, got it. Thank you so much, Kirk. I can't thank you enough. I enjoyed this conversation. And like I said, some of this I knew and some of it was a big surprise. And I know that's probably the case for a lot of our listeners. So thank you for your expertise.
Very welcome. Thank you for having me.
And thank you for listening to our podcast series on managing foodborne illness. We encourage you to explore all of the many courses available on elitelearning.com as you move forward throughout your career. This is Leanna McGuire for Elite Learning by Colibri Healthcare.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.